Please welcome to the stage Kara Carter, Senior Vice President, California Healthcare Foundation.
Good afternoon, everybody. It is a pleasure to be here on this beautifully sunny day. I'm Kara Carter. I am the Senior Vice President for Programs at the California Healthcare Foundation, and it is an absolute honor to introduce our next conversation. I'm excited to welcome a Fireside Chat focused on solving California's mental health crisis. At the California Healthcare Foundation, we're deeply committed to improving the systems that serve Californians and their care needs, including behavioral health. We're also deeply committed to supporting women leaders that drive the changes that we need to create sustainable systems. Today's discussion will highlight both. Our guest, Ann Bakar, is the president and CEO of the Telecare Corporation, a company her father co-founded in the Bay Area here 60 years ago. The company has a mission to provide compassionate care for people living with complex mental health needs. Ann is also a friend and someone I've admired very much over her career over the last many years we've known each other, and very much admire the company that she serves. Under her leadership, Telecare has grown from a regional provider to one of the nation's most respected behavioral health organizations. It now operates across 5 states with more than 170 programs and serves 48,000 people every year. Its workforce is more than 70% women. Ann has been a champion for innovative treatment models and a tireless advocate for access to mental health care. She played a pivotal role in advancing the Mental Health Services Act, Proposition 63, the 2024 Behavioral Health Services Act, and she continues to serve on a number of boards, including the Steinberg Institute and the UC Berkeley Board of Trustees, as well as many other ways that she serves her community with organizations that are focused on mental health equity and workforce development. Leading today's conversation is Jim Wunderman. Jim requires no introduction, but I will introduce him as the president and CEO of the Bay Area Council. Jim is also a longtime advocate for innovation, inclusion, and forward-looking policy solutions that strengthen California's communities and our economy. Please join me in welcoming Ann Bakar and Jim Wunderman.
It's great to be here with you, Ann, and love what you do, and we've known each other a while, haven't we? And so I was excited to have the opportunity to talk to you. So you came into this
Before you ask a question, can I just say something?
You can say anything you want.
Women taking charge, right?
They really want to hear from you. They already heard from me.
I just wanted to start by saying that I'm really deeply honored to be here today. It's the 60th anniversary of our organization, so it's a really important milestone. I won't tell you how many decades, 35 plus years for me, and so I have been in this kind of reflective mode, and having the opportunity to impart some of the experiences and wisdom and learnings that I've had is deeply gratifying to me. So I really just wanted to say that. I also wanted to say that I feel like you, Jim, have been a kindred spirit. Not everybody knows this, but Jim actually worked for me about 35 years ago. And you did an outstanding job, just as you have done an extraordinary job here at the Bay Area Council. And I just want to take a moment to applaud you as you make this transition. I feel like we have shared values over decades. I'm a third-generation Sanford Bay Area resident and really have been committed to growing the healthcare infrastructure as you've been really committed to building the Bay Area business and civic community, sort of standing on the shoulders of legendary mentors that we've had, like Bernard Tyson from Kaiser and Dick Rosenberg from Bank of America. There's women leaders on the roster too. I was looking at the Bay Area Hall of Fame and Mimi Silbert, Mary Cranston. So sort of standing on the shoulders of leaders who have taught us how to move forward and how to really carry on the extraordinary culture in the Bay Area. So you've done that in spades. I've done that in healthcare, but again, I really just want to thank you. Thank you for all your leadership.
You're very kind. And you're in the Bay Area Business Hall of Fame too.
I'm one of I counted the women. I think there's 5 out of 25.
But the number's growing. It's growing.
Yeah.
It's growing. And you have to, Some years ago, we had a board meeting at the town just to the north of us, Santa Clara, and we had as our speaker Governor Schwarzenegger, and he didn't want to make a speech. He wanted to be interviewed, and I got the job of interviewing him, and I had all these questions, and I said, so welcome, Governor Schwarzenegger. And they were good questions, you know. Welcome, Governor Schwarzenegger, and he said, and that was the last I spoke. Well, you know, let me tell you about the muscles and the, you know, so we all got to hear a lot about the story of Arnold, which people wanted to hear. They didn't want to hear.
You want me to ask my next question?
So you know, having known you for a long time, I wasn't there in the beginning, but I know you had a tough start to this. You weren't planning for a career necessarily running this healthcare organization. It was something your father had started, and you were headed for a career in business, and he passed away.
Yeah.
And there you were in a position where you probably could have gone either way with it. And you decided to take the reins of this. But tell us about that start and the challenge, you know, the basic challenge you had of taking over an organization in the difficult time and moving it forward, and what was that like, and why did you do it, and what you learned from it, and all of those things.
Yeah. So I used to joke that shortly after my dad passed away in '87, that if he was alive, I'd kill him. Because it was really sudden. It was extraordinary. And I had actually I spent about 8 years at a boutique firm called Montgomery Securities in the rough and tumble investment banking world, and I actually loved what I was doing. I was, you know, those were the days Larry Ellison at Oracle was going public, and Steve Jobs and Bill Gates, and so I was really kind of in a man's world, and was an analyst and ended up working in corporate finance and venture, and I was really fascinated by the change that was happening in technology. And then my dad passed away suddenly, and I'm, you know, the youngest of 3 girls, but I'll never forget the trip to the hospital, right? He said to me, I really, you know, I want you to do this, and he said, I think you're the only one who can manage the personalities. I actually remember him telling me that. And then when he did pass, you know, now in retrospect, at the time I said, well, I need to analyze this and figure out what to do, you know. But if I had really analyzed it, I probably wouldn't have done it, because it was kind of a precarious time. The reimbursement was coming down significantly with managed care. It was overbedded. There were too many hospitals. They were advertising, is your child depressed? Come to our hospital. So there was sort of abuse, actually, of the mental health benefits. So it was really a time when large companies were under a lot of pressure. My dad's main operation was a psychiatric hospital, so we were in the hospital field. And when I think back on it, I realized that, you know, there really were a lot of motivations that were there, many of which still motivate me today. Like, I think, first of all, my dad believed in me. Like, I was 29, and a lot of people were like, are you out of your mind? Like, this woman, what are you doing giving her the baton? And I just, you know, he had hope and belief in me in a way that was super powerful, and I was not gonna fail. Like, failure was, I was gonna take it, and I'll never forget that sense of fierce determination, humility, but I was not gonna fail. I was gonna make my dad proud. And then I did grow up with mental health at the dinner table in our family. I actually, even though it was One Flew Over the Cuckoo's Nest, how many of you have actually seen One Flew Over the Cuckoo's Nest? Right, so it was the state hospital, and actually I think John F. Kennedy's sister had a lobotomy, Rose Kennedy. It was like really a horrible, don't go into the snake pit. And you know, my dad and his partners created an innovative psychiatric hospital that was, you know, a beautiful environment. There was an article, this is a hospital? It didn't even look like a hospital. And they had care that was individualized and recovery oriented. And so I think I really felt a sense of purpose. Like, this was something that was, you know, technology was interesting. This was really meaningful work that I had grown up with. And I felt like it was so important that I do it. And even now, I mean, we could talk about behavioral health. Mental illness is the biggest public health crisis of our time in terms of, you know, I won't go down that path yet. But so I think that really motivated me. And I think the other thing is, I could talk about this a lot. I just, you know, I think coming of age as a woman at that time, I really wanted to prove my mettle as a businesswoman who could have a social impact. So I think I was very kind of had my own sense of self-determination in terms of my ability to do this and be successful at this. It was a mission, and it was also a business, and so I think I felt that sense of mission, and I also had that business competence as well, so it blended those two things together.
Fantastic. You know, so you brought me aboard as a consultant because you were determined to grow the organization. You believed in it so much. You know, at the time, it was really a regional player here in Northern California, and sizable, but nowhere where it is today, $700 million organization, which is really an incredible growth and success. And, you know, you've become such a, you know, renowned leader in the field.
Thank you.
You know, what, as a woman leader, what did you face? Like, what tribulations came up, and what did you learn, and who helped you through it?
These are big questions. I think there's so many, no, it's good. I think that there's just, you know, there's many ways I think about my leadership journey. One thing in particular that I was going to say, I was thinking about as a woman in particular, you know, I do actually think, even though it's a given, having that business background was really not just essential to my competence, but it was essential to my credibility in the environment that I stepped into. And again, even to this day, Telecare just did a major financing. We want to raise a lot of capital to deal. We have one of our banking partners here today, Tao from Comerica. And, you know, I felt like I could go toe-to-toe with any banker in the room. You know, like if he was 29, if he was 59, I knew what to say. Because I had been in that environment. I had, you know, worked analyzing, you know, in publicly traded companies and having those calls and talking about the industry and the competition and the you know, financial projections. So I actually think having that confidence is really, really important especially as a woman in business. I think the other thing is that I would really stress this, when I'm in a crisis, and we're sort of in a crisis right now with Medicaid. You know, you could argue the Medicaid environment is a very daunting thing. Mental health isn't going to be affected directly, but indirectly. I really traverse outwards to ask for help. Like some people kind of go inward. I really feel like throughout my career, I have gone out like an octopus, kind of like to find the best people I could to bring them in to advise me. And you know, getting the right people at the table. So when early on, I actually went down to Stanford, even though I'm a big Bear fan to Galileo. And I took a class serendipitously from a lecturer there named Jim Collins, who was writing about built to last and good to great companies. And he was a lecturer then. I didn't know he was going to become the greatest business mind in America later on. But I brought him in, and he actually helped us develop our whole built to last kind of vision and values and approach at Telecare. And he still actually is a mentor to me. We're in one of his latest books, Beyond Entrepreneurship 2.0. So I found Marianne Tosio, who's the current chairman of our board, to come in, who is the president and chief operating officer of Bright Horizons, which is the largest early childhood education company nationally. She has 60,000 employees. And so when I get scared about going from 5,000 to 7,000, Marianne's like, growing is great. You know, you have more employees, you get bigger, you have more money to invest in culture and infrastructure and in your people. So she's really helped me to think about how to scale in a way that could keep our culture going. I would say Daryl Steinberg is another person who I reached out when we've had crisis in 2007, and it looked like the whole safety net was gonna unravel in mental health. Daryl was like working on the Mental Health Services Act, Prop 63, and we were an early, I mean, Telecare is not only a provider, we are a advocate. Like we are people here today, we're on policy boards, we work collaboratively with boards of supervisors. We see our role to advocate because there's so much stigma in mental health. I mean, there is. So we, you know, Daryl Steinberg, you know, we were door to door raising money from the Mental Health Services Act to get that. Now it's Prop 1, which is the billionaire's tax, which has added over $3 billion to the mental health system in California. So I guess that's a long-winded way of saying that I'm good at asking for help.
Well, I think we all saw it as a good cause, that we were going to actually, California would attend to the mental health crisis of the day that we were facing, and we knew there were, you know, huge shortfalls in the way we were able to deliver service in the counties, and you know, that was a real game breaker.
And it's still, especially now, because those funds they're not Medicaid dependent.
Yeah.
And so as we look at what's happening in California right now, the fact that we do have those dedicated funds is really, it's going to provide shelter.
You take care of so many folks and so well. What do you see as the root cause of the mental health challenge or crisis that we are facing here in our state and in our country? What's driving this?
Every time I visit a country, I was in India 3 years ago, and then I was in Japan, I look at the suicide rate per 100,000. And the suicide rate per 100,000 in America is 14. It's 10 in the EU, it's 12 in India. It actually is a little bit higher in Japan. But I mean, if you look at developed countries, all the data in America is I don't even know what, it's kind of devastating. I remember in 2017, I was at the Hall of Fame and there were fires going on. And I remember saying, there's a fire in our country in mental health. I mean, mental illness is ripping apart the fabric of our families and our communities. We need to take care of this, We need to take care of the fires, but this is a fire. And, youth suicide is the leading cause, second or third leading cause of death among people 15 to 25. We had over 170,000 substance use deaths last year, over 200,000 deaths overall in America, and homelessness, incarceration, everywhere you look. I don't want to get everybody to, everywhere you look, we are impacted by mental illness. And the scale and scope of the need, the demand is growing. We don't have a large enough workforce to tend to it. And so what's the cause? I think it's a very complex question. I think that, we know that there's a biological root to mental illness, but we also know that there's very significant social determinants. COVID was a huge factor. Vivek Murthy, the former Surgeon General, wrote about the loneliness epidemic and how people in America are lonely. They don't, loneliness causes grief and mental illness. We have, social media is definitely a variable. I think the breakdown of institutions, people, some countries, maybe they're not as rich, but they have more family, community supports for them. So I think right now it's not uniquely American, but it is uniquely American because I think our situation in America is so profound. I think, if I leave you with only one thing today, I would like to suggest and encourage you to advocate for, volunteer, come work for me. If nothing else, I would like to encourage you to, be an advocate, learn about this topic, and get involved in advancing, because it really is, there's so much stigma. Some people said that COVID did for mental illness what the AIDS epidemic did for AIDS, because it brought people out of the closet, because people for the first time kind of came out and said that they needed help. And I think that's true, but I also think there is tremendous stigma, and I think that there is not enough of investment. There just isn't enough investment. And what we're going to see in this environment even though there aren't direct Medicaid cuts to mental illness, I think there is going to be systemic pressures on it.
Talk about that a little more. So you touched on that, and whether it's direct or tangential, some attempts have certainly been made in this state to create shifts to provide more and better service for people, and I think there's been really good intentions around that, and yet you get the sense that maybe not everybody's working in sync on it, and the state and the counties and so forth.
Yeah.
Prop 1. How's it going out there, and what can, if we're to advocate, what can we be advocating for that could really fill in some of those gaps?
Well, I think, in California, one of the big things that's going to happen is there's going to be work requirements, and how California sets up that is going to affect people who are, even people who are disabled. So I think the implementation of sort of how this rolls out in the state, and I'm going to be involved in statewide groups that are going to be looking at how the Medi-Cal system responds in this environment. So I think sort of following the policy and just speaking to the people that politically you interact with around the importance of mental health without getting into the technicalities of it would be helpful. I think that one of Telecare's strengths that has really buoyed me over the years is that our ability to work in these innovative public-private partnerships with counties at a local level to create local solutions that are really helpful. In Santa Clara County, for example, we actually have a very innovative substance use and mental health program called Muriel Right that allows people to get treatment for their mental illness and their substance use together, which is a systemic problem because there's barriers right now between how that care can be delivered. In San Diego County, I think one of the most popular services we've ever created in partnership there was a 988 crisis line. So people can just dial 988, and Telecare has a 24/7 receiving call line, and we send vans out, like first responders, to go to help people in their homes with whatever their need is. And I think that's a great service because mental health access is a black box for a lot of people. It's like, how do I get help? You know, and so I think some of these local approaches, like, you know, most counties have crisis services, but I think there's some, you know, more robust approaches that we're working with counties on right now. San Mateo County, that I think can be very helpful. We're working with Kaiser actually on an intensive community support program where we go to people's homes and help them to get motivated to come in to get their care. People sometimes don't want to get care, so they kind of need motivational interviews. So I guess I'm saying there's kind of things big and small that can be done to advocate in terms of asking for programs from your local leaders, in terms of speaking up whenever you're in a political environment about, you know, concerns about how Medicaid's being implemented. So I think there's local ways, and I think there's larger ways as well.
It's always been a pleasure to hear you talk about healthcare policy, mental health policy, and so forth, whenever we've encountered each other along the way. You know, you're so informed on these topics, and I think really when it comes to advocacy, you play such a valuable role because what you've done and the leadership that you've shown, and people, I think, really trust you to understand like what we're doing right and what we need to do.
Well, I think as a woman in particular, I was thinking about, like, we don't like to differentiate how we're different as women leaders, but we are different as women leaders. And I think that there's things that we call attention to through our leadership, like the purpose of what we're doing. Like, why do we do what we do? And I feel so grateful, honestly, especially as I get further along in my career, that I get up every morning and I'm doing something that, you know, changes lives. Changes lives. It's making communities stronger. And so I feel like it's been a privilege to do that. And I also think dispelling the stigma that mental illness is a death sentence, like people don't get better, because, you know, that's another important message. You know, people get better. We see it happen. We see thousands of lives every year improved and moved on. So people moving on. So I think that's an important thing to hold on to also.
My brother was severely mentally ill for over a decade and lived in England, and it just was a devastating thing for me and for our family. And you know, he recovered. And it's the most amazing thing I think. You know, he's the sanest person I know.
Did he get treatment?
He got treatment.
Yeah.
And then, you know, but it took a long time for that to happen. But it's amazing to see that how recovery can take place. I never would have thought. And it's just, I'm so happy every day that we talk and, you know, we reminisce and, you know, it's my single siblings. It's quite amazing. Just a few minutes left. You know, Telecare is consistently rated as one of the best places to work in the Bay Area. When I did work for you, I noted how strongly supportive you were and how you took counsel from your team. And then a few years ago, 30 years later, you had me speak to your board.
Just last year?
And they were the same people. We're there, and we had, hey, you know, talk about the, you know, leadership culture and how you feel, you know, how is it you've been able to create such a strong sense of place in Telecare?
Well, we actually talk about our culture actually as an intervention for the people we serve. Because think about it, if you go to a mental health program and they've got all these evidence-based practices and people are being very disrespectful to each other and it's a toxic environment, it doesn't really help you recover, right? And so we really reinforce, you know, our purpose is to help people with mental health challenges to realize their potential. And therefore, we have to have a workforce that also feels like they can realize their potential. Like they have to feel like they can grow in the organization and the culture. And so we really, and I would say many of the people who work for us have family members or have had some experience themselves with mental illness, so they come to it with a sense of purpose. But workforce in general in the field right now is a challenge because there are not enough workers. I mean, I was on the California Healthcare Workforce Commission that Kara established with Sandra Hernandez, I think 8 years ago, before COVID, and the supply-demand gap for psychiatrists in California was greater than any other area of healthcare. The average age of psychiatrist in California was like 65 then or something. And so workforce, the need to build workforce. That's why I said, come work for us, please. Anybody here interested? Raise your hand. I'll send somebody over. Developing workforce, retaining workforce, creating that engaged, motivated is it's an absolutely essential part of our work. And, we do everything. It's like all hands on deck with this the last few years in terms of not just making sure that, our compensation is more than competitive, but we have an employee stock ownership plan, so our employees are able to participate in the future success of the organization. Growth and development is really vital for the people who work at. We want them to know they could make a career here, not just work in a job, but they can grow here and advance. And then I think people really, it's like I say we have a tree of life that is the logo of the company that my dad started. We talk about the trunk of the tree as being our roots, our foundation, and the branches sort of stretch out with a mission. But the trunk of the tree is people being in an ecosystem that is respectful. Like we live in a world where it's so hard. You read the newspaper, it's so hard. Everybody's so polarized and people are disrespectful and people aren't hopeful. And so we oh my God, we have this little tent. We call it Telecare. Like we can kind of create our own culture. It's the way you think about your families probably. Like you have control within your family to create an ecosystem that is respectful and empowering and motivating. And that's kind of our secret sauce besides our clinical approach. But like our culture, is a place where we have some control over what we create. So I think people, of course, it's not always that way. I mean, it's not like fairyland. Like we have challenges like everybody else and, we get the letters and this and that and the next thing. So we have lots of challenges, but we are committed to that continuous improvement. And I think, that's why people end up staying with us a long time. Our first year turnover is too high though. First year turnover is, I think it's like, I'm not going to tell you the number, just so you know I'm not smelling the roses all the time.
My wife wanted to be a psychologist and thought about it, and partly because I had worked with you and seen that culture and the people who worked in the field, I encouraged her to go back to school, and I don't know, 10 years later, but she's
well, she
has
can
a
come.
doctoral degree, and she
Yeah.
and she has a phenomenal career.
Yeah.
And she gives back to people, and she works with people experiencing trauma
Yeah.
every day. I don't know how she does it,
Yeah.
but she has a very fulfilling life as a result of doing it, and she's doing good in society. And I guess every person who works for you, is doing that.
Well, there's kind of this I don't know how many businesses, a lot of businesses, but we have the individual purpose, like we're helping an individual, and then we have the sense of community purpose because we work in like these systemic, we work in partnership with counties and plans to solve systemic problems. We don't have a product like buy our hospital service or buy our resident. We how can we solve your problem? And so we look at the community as a whole, and we feel like we really develop innovative solutions like this 988 crisis that I was talking about. And then we also have the policy level where we are advocating for change at a broader level in terms of really breaking down silos in the system of care and ensuring people have more access to care. So there's various levels where I think I feel very engaged in. I tell people I'm working on AND 4.0 right now.
Given all the polarization, have you thought about opening in Washington, D.C.?
People ask about Hawaii usually. When I go to most people want to go. Have I thought about watching about DC? You're joking.
Just in the last minute, because that's what we've got. Just this is your moment to give advice to women who are on the leadership journey, what's a couple of ideas for, how women can succeed in this environment and, rise to
Right.
the top like you have?
Well, one thing I've been thinking about is with AI and technology, everybody's talking about scaling, scaling, scaling. And I was thinking, how do you scale a business if you don't scale yourself? And so I think, I made this joke, I'm on AND 4.0, but it's not a joke. like I've always had this, I guess you could call it a growth mindset. Like, I wanted to be the best version of myself I could be, My dad believed in me, he helped me have that, and I've had other people who have believed in me and helped me with that. And so I'm always, probably till the day I drop, I want to be the best version of myself, and I want to grow. And that's not just intellectual, I want to stay on top of what's happening in neuroscience and what's happening with AI. So part of it's intellectual, but part of it is just that emotional stretch, Like I remember I used to joke when I first had kids that, I was going to be the better CEO because I had to delegate something for the first time in my life. I never delegated before that, And I recently had a loss, a very painful loss, and I've talked about it in the organization and about, that I started reading poetry to. I've been vulnerable with the organization. Now I include poetry. Tomorrow I'm giving a speech, I'm including poetry. and my workforce loves it, Like, oh, Anne's got, Anne has this interesting, so I think kind of like scaling yourself, and having people in your life who will help you. We don't nourish ourselves in relationships enough. You get rid of the toxic relationships. You don't need that, right? Bring people in who believe in you, who see the you that you don't see yet. My dad saw that in me. My husband saw that in me, thank God. I have friends who see that in me. I have, people on my board. So, find those people who believe in you.
Well, I see it in you, and we see it in you, and thank you, Anne, so much for doing
Thank you.
that.
What a privilege.
Anne Baker, thank you. Thank you.
Okay.
Fantastic.
Yeah.